All right, who would like to go next?
I'll be happy to. If you, I'm Dr. Lynn Rew, and I'm the director of the PhD program in nursing. And whenever I tell somebody new that I just met that that's what I do, they say, "Why on earth would anybody want to get a PhD in nursing? Is there really such a thing?" And so my husband always says, "Oh no, we're going to be here a while," because I take that opportunity to try to educate the rest of the world about how important it is for us to have PhD prepared nurses. And just to give you a little bit about my background, I grew up on a farm in Iowa. I was never intended to be a university professor, but I really wanted to be a doctor. And my family and my school and my church and everybody said, "Oh no, you're a woman. Women can be nurses and they can be teachers, but they can't be doctors." And somehow that got really permanently implanted in my brain, and I've been fighting it ever since. But that's the path I followed. And after I got my Bachelor of Science degree, I worked for 5 years in a community hospital and did just a little bit of everything: maternity, ER, med surge. I very rarely did child health, which is interesting because that's where I ended up. But I then went back to school and got a master's degree in community health nursing and taught for 5 years at a community college. And again, teaching in a community college, I was able to teach across programs. So I had students in every single area that existed in the hospitals where we had our affiliations. But then I got so interested in going to school and learning that I just kept going until I had gotten my doctorate. So after 5 years at the community college, I came to Texas and got on the tenure track here and really didn't quite know what I had gotten myself into until about a year or two down the line when I said, "Oh goodness, I have to develop a program of research and I've got to keep publishing," and so on and so on and so forth. That was 38 years ago. So I've been here for a while. I kind of know my way around by now, but I can tell you this has been the most rewarding kind of career I can imagine having. And to you who are still either in your bachelor's program or your master's program, I want to just tell you that you should consider getting a PhD in nursing because we have very few of those people. And people who are my age would like to leave at some point, but we can't because we don't have enough replacements coming on board. So we really want to encourage people to come directly from their BSN program, directly from their alternate entry program, or through other master's programs into the PhD program. It will take you anywhere from 3 to 6 years to finish. I can work out a plan for any of you that you want to talk to me about. And what we want you to do is to know that you can have a career that is most satisfying. We really need you as educators and researchers. And we also need you to help develop and what's the other word I'm looking for? Administer policy in all kinds of different settings. We even have one of our PhD graduates who works for our federal government in Washington, D.C. So anything is possible. Come and join us here at UT or somewhere else if that's where you end up. But think seriously about what can you do with a PhD in nursing. I'll be quiet.
Thank you so much, Dr. Rew. I actually have a question for you about the PhD program. So,
okay, fire away.
How are students able to really tailor what they end up doing their dissertation on, or does it really need to fall in line pretty closely to what faculty are already doing, or can they sort of, for instance, I know that there's some biological research being done in the biobehavioral laboratory, and there's specific projects that are being worked on. But is it possible to sort of take the techniques that are being used and tailor it to, a different direction? Or does it need to kind of fall in line with what already is being done?
Well, the answer to both of your questions is yes. Yes, you can follow your own ideas here. Yes, it does help if your ideas align with those of the faculty. But we have had many students who've come here with a completely different idea about where their research was headed than what really matched exactly with the faculty. So we try to have applicants, and we try to admit those whose research interests are closest to what our faculty interests and research programs are, but it's not always an exact match. And the thing is that even if it's not an exact match, we know how to find other people who can be part of your committee, part of your coursework. You take a few core courses in the first year and a half. After that, the other courses you take are all tailored to what your topic is going to be. So we find people in other departments to help fill in the gaps where we may not have that expertise. Hope that answers your question. If not, we'll talk more later.
Yes, it does. Thank you so much. Who would like to go next?
I can go next if you want. I am Laura Murphy. I am the foundation year coordinator for the alternate entry students. I see a couple of my people here, and so welcome to all the others. In my program, y'all are already in nursing school, so I guess you don't need advice on which program to pick as far as starting nursing school, but I can second what Dr. Rew said about going back and doing your PhD. And I was also one, like Dr. Carter, who said that I'd never go back after I got my BSN, and I did go back for my MSN, and I'm wrapping up, hopefully, my dissertation study next semester. So I'll be hopefully earning my PhD as well. So yes, I do recommend it. I did the more traditional route, I guess. I did my traditional BSN in nursing here at UT, did my MSN, and had a specialty in maternity nursing because I'm an OB nurse through and through. I've only ever done that during my career outside of nursing school. And so I can speak to perinatal or obstetrical nursing care. That's anything from labor and delivery to postpartum care to nursery, and a little bit about NICU. I'm definitely not a NICU nurse, but anyone who's interested in that kind of area or job definitely can ask questions of me. I recommend it. I love it. It's exciting to be there in a very special time in families' lives for the most part. So that's me.
Thank you, Professor Murphy. And again, if anyone has any questions, just drop them in the chat or feel free to unmute as we go through each area.
Okay, I'll go. I'm Dr. Christiansen. I'm also a faculty sponsor of ANGS with Professor Murphy, soon to be Dr. Murphy here as well. So I will echo what Dr. Carter and Professor Murphy just said about never say never, because I have had probably one of the most tortuous journeys to becoming a nurse. So I actually started in my undergraduate time working as an EMT and a phlebotomist. And then I decided to go to respiratory school. So I was a respiratory therapist for about 10 years before I decided to go to nursing school. And as a respiratory therapist, I worked in all of the ICUs. Least favorite was burn ICU. Probably most favorite was neonatal ICU. I am pretty much pediatric focused at this point. And then I decided to do the alternate entry program like many of you at UT. And worked as an emergency room nurse. I worked for 1 year as a school nurse as I was in the program, which worked really well for the scheduling. And I know one of the sessions coming up is how do you work while you're in school? And that's a very important session to figure out how you're going to make that work with your personal life. But after I was a nurse, I did the primary care PNP program, the acute care PNP program as a postmaster's. Then I worked in the same emergency room that I was a nurse in. I worked as a nurse practitioner for many years and decided to go back to the DNP program. and did that. Then I also did a postmaster's in nursing education and as a family nurse practitioner. So don't say no to going back to school because you never know what's going to happen. And I am also in my final semester of a PhD program right now as well. So, and Laura and I go to the same one and have been commiserating together about that. So what I do now for UT, I've been at UT for about 5 years, and we just restarted our postmasters acute care PNP program. We have our first group of students that will graduate next May, so they're almost done. And I also teach in the DNP program. So Dr. Jane Champion is the DNP program director, but she couldn't be here today. So she asked me to speak a little bit about that one too. So if you're considering doing graduate education, there's 2 terminal degrees in nursing. There's the DNP, which is a clinically focused doctorate, and then there's the PhD, which is a research focused doctorate. So the beautiful thing about being a nurse is you are a nurse at your core. So as Sharon mentioned, with all the different paths that lead students take, where you start your career is not probably going to be where you end up. So you have that background in nursing and you can go many, many different roads with that nursing degree. So just keep that in mind, that many, many doors will open for you. The more education you go through, the more doors that open, the more programs and the more transitions and jobs that you have, you make more connections. And a lot about successful nursing careers is the connections that you have. So always network with people, join your professional organizations, meet those people that are like-minded as you. And that really introduces things that you never thought you would do before and you end up doing, and it's a perfect fit. So I know I talked like in a roundabout way there. So if you have questions about any of those programs, I would be happy to answer them. I don't recognize the names of the students that are on here, so I don't know like where you are in your nursing process and your education process. So maybe Ashley at the end, the students can just briefly give a sentence or two about where they are, where they think they're heading, and we can kind of focus more of the discussion to specifics of what they want to know, perhaps.
Yes, thank you, Dr. Christiansen. I think that's a great idea since there aren't too many. I think we could definitely go through that.
I just want to say that I second Dr. Christiansen as somebody who has a doctorate but doesn't quite have that PhD that I know Dr. Rew would love for me to also obtain. The clinical doctorate, otherwise known as the DNP, is a fabulous and fantastic degree for those of you that are clinically oriented in nursing. And there's many things you can do with a DNP, and it's just as wonderful as a PhD.
All right, I guess I'll go. I just had to do the math, but I would first of all say thank you to you all and ANGS for inviting us here today. And it's always exciting to talk about such an amazing profession that opens so many doors for folks and with so many opportunities. I've been a nurse for 45 years. I knew I wanted to be a nurse from 3rd grade on. I can still remember the picture I drew in 3rd grade when they said, "What do you want to be when you grow up?" But anyway, I went to an associate degree program. And then right after I finished that, I was only 20. And I said, I'm not done with school yet. So I went and got my bachelor's degree. And I worked in ICU my first 2 years of my profession. And then I decided I wanted to do everything in my power to keep people out of ICU. And I started focusing on community health. And that took me to Latin America. I worked with health promoters there. I worked on the US-Mexico border for 15 years with health promoters as well. And at that time, I said, gosh, I want to know more. I just kept wanting to know more. And I was able to get a master's in community health nursing from University of Texas at El Paso. And they had a program where you could get your master's in community health and your FNP. So that FNP has opened so many doors for me. There are 325,000 nurse practitioners in the United States. And as many of you have said, there are so many different paths that you can take. The big percentage, I think it's 90% of nurse practitioners are in primary care, which is what I do as a family nurse practitioner. We care for people throughout the lifespan. And, you know, we do all kinds of great things to promote health. prevent disease, treat people with acute and episodic conditions. We treat folks with chronic disease, but mostly, you know, we bring all that incredible nursing education and skills to that profession. So we're good patient educators, but we can also make just an incredible difference in patients' lives and their health outcomes. I too was one of those that when I finished my master's, it's like, oh, you know, they said, you've got to go back and get your doctorate. And I'm like, heck no, you know, I would almost get PTSD when I go by the school where I got my master's because it's hard work, right? But a few years later, I moved to Austin and finally got to come to UT to pursue my PhD. And I had brought lots of years of nursing experience. And my focus area was intimate partner violence and how we as nurses can try to decrease that prevalence and promote health in women that are, and men and children that are affected by domestic violence. And so that's what I focused on when I was doing my dissertation here. I finished in 5 years, and luckily a spot opened here, you know, on faculty in the FNP program. So I coordinate our FNP program, and it was always my hope and dream to kind of pass the baton to the next generation. I also, what Dr. Rew said about, you know, we're getting older, and so it's like we would love for this new generation with much more energy and new ideas and passion, you know, to carry things forward. And I just think we're just all so privileged to be part of this most trusted profession, and yeah, all the incredible ways that that profession has made a difference in our lives and the way that we can make a difference in the lives of the people that we work with. I love my students. I love my patients. I work, you know, in a federally qualified health center, and then, you know, it's hard to let go because I have two aspects of my job as a nurse practitioner that I love. So if you have any questions, I'm here.
Thank you so much, Dr. Divin.
I guess I'll go. I just love seeing all my colleagues here too, and thank you all for inviting me. I'm Stephanie Key. I'm the director of the Primary Care Pediatric Nurse Practitioner Program. Been teaching here for going on 18 years. I don't know where the time went. I was an AE back in the mid 90s and maybe the third or fourth class of AEs ever. Came back wanted to be a nurse, thought I was going to go into gerontology, and then did my pediatric rotation and fell in love with kids. And so all my nursing experience has been in PD, and then I transitioned into the PNP program from the alternate entry and got a job right after graduating, still practicing with that same group that hired me 20 plus years ago. So I have patients now that are having babies, and I love that continuity of primary care. It's the basis of all nurse practitioners is primary care. You have to understand the normal before you can really take care of the truly sick. Dr. Rew and I had many conversations when I first started teaching about going back to get my PhD, and she did a good job encouraging me. I just kept finding barriers kept happening, like life, like a kid or a child, another kid, or, you know. And so I put it off and finally ended up going back 20 years after I got my master's and got my DNP. But if I had been a little bit younger, I would have done the PhD or done both, because I think they both serve a very vital role in nursing education. And I see kind of the future is bringing doctorally prepared nurses, the research and the clinical together that really are going to do the best to improve patient outcomes. So I see us working together for the future, and that's going to be very important, that all nurses need to have some form of a doctorate going forward. And I love what I do. I get to teach, and I get to see patients in clinic, and then I still mentor. Just before this talk, I had a student who graduated 7 years ago call me up out of the blue, asking me about going to get her doctorate and wanted some advice. So I think it's great as educators, we can stay in your life forever, even after you graduate, that you can call us years later and we can talk about, you know, what are your options? So I'm happy to talk with anybody about pediatrics.
Thank you so much, Dr. Key. I think maybe Dr. Cruse, you are the only one left to go.
Sorry about that. I was shoving some pretzels in my face. So I'm Dr. Cruse. I'm still getting used to the title since I just got it in May here from UT. And I've been teaching for, this is my second year teaching here at UT, and I teach in the Psych NP program and APRNs, and I also teach psych clinicals to the BSN students. As far as my background and preparation and what else I do besides teaching, I'm a psychiatric nurse practitioner, I am an acute care nurse practitioner, and I'm a family nurse practitioner. My background in nursing prior to becoming advanced practice was over 20 years of ICU experience, the sickest of the sick. I worked at Seton, Maine, open hearts, heart transplants, you name it. I actually initially went back to school after I was diagnosed with breast cancer. And then I decided that I wanted to make some changes. I could no longer really do bedside nursing because of the physicality of it. And so I was like, okay, well, this is a good reason to go back to school. So I did, and that's when I sort of started down this trajectory. I ended up deciding to teach based on all of, actually, honestly, the faculty at UT, the people I interacted with when I was in school. I had been acting as a preceptor for years, like both at the bedside and then once I became advanced practice. And so I always thought, well, I'll just precept. That's good. I'm good with precepting. But I had some wonderful faculty, some of which are here, notably Dr. Christiansen. So I had some good role models. Dr. Rollin, who's in charge of the Psych NP program, also was a mentor for me in terms of deciding to teach, because I've always just viewed myself as a clinician and never really saw myself in the role of being, a professor or educating in a formal way. And, I found that I really enjoy it. I definitely enjoy the combination. I still see patients. Right now I'm practicing in a psychiatric practice, but I recently stopped a job where I was working overnight as a hospitalist doing acute care. So I have a lot of different interests and backgrounds, and I feel like that's part of why I decided to start teaching, is I feel like that helps me be a resource for people, is that I have so many different things that I've learned over the years and sort of specialized in and worked in different areas. And I feel like that's one thing that nurses, as you get into advanced practice, you end up having to pick a lane, and I'm not a huge fan of picking a lane, obviously, but I also think that it really goes to that holistic approach for nursing of, it's not just psych, it's not just acute, it's not just family, it's not just primary care. And so I like bringing everything into the big picture, like, oh, look at the kitty. I feel like that's important, that we don't lose the fact that nurses can work anywhere and do anything. Back when I went to nursing school, that was part of why I did it, is that I always knew I'd have a job no matter where I went, what I did. I'd always be able to take care of myself and my kids, and I could help people. And like I said, I wasn't a fan of having to pick a lane and stay in it when I went into advanced practice, obviously, since I have my first degree and 2 postmasters. And because I think that all of my things help each other. Like when I was doing acute care, the physicians were coming to me going, so I heard that you're a psychiatric nurse practitioner. Can you help us with this patient who's got this going on? And same with psych, there's plenty of times that I have patients who have physiological conditions going on that I'm not treating it, but I can certainly take that into account with their psychiatric condition. And sometimes they see me more than they see their PCP, or I have more time with them than their PCP, and I can talk to them a little bit about things. And so that's just kind of my approach, is I think that you have to look at everything. You know, I guess I'm the champion for holistic care. And that's what I try to impart on my students. That's sort of my specialty, is look at the big picture. Don't look at just, don't box yourself in and just looking at one little thing. Because we're taking care of the whole patient, we're taking care of their families. You know, the idea is just to improve health for everybody. And then I look at that with my students as well, as I try not to get into one little box either. It's like, yeah, I'm teaching you chronic illness or advanced health assessment, but if I can help you, if you have interest levels in anything, or you just want to talk about other things or ask how things go, I like to be able to be a resource. But that's about it. If you have any questions, I'm happy to answer them.
Thank you so much, Dr. Cruse. So I think all the faculty have spoken. Do we want to go through the different students who are here and just maybe introduce yourself and say which program you're currently in and what you're interested in doing going forward?
I'll go first. Hello, everyone. My name is Lynn Rew. I'm in the AE PhD program, still in the foundation yet. I'm interested in research. I'm so nervous. I'm interested in doing research, so yeah.
Don't be nurses. We want you here and we want to help you, and we just want to know more about you.
I'm interested in doing research, teaching, and I want a little bit of being able to have patient experience as well. I did some research in neurosurgery, so I'm interested in following in that path. But I'm also open to any other research too. So my interest is just research. So I want to do research.
Dr. Rew, I think you found someone.
Yes, thank you. Yes, we'll be talking soon, I'm sure. I forgot to tell you that my area, by the way, is adolescent health, and I particularly focus on substance use and sexual behavior in homeless adolescents.
Okay.
So, but I do a lot of other adolescent stuff too. So I might get you interested in doing something with adolescents.
Okay.
Nice to meet you.
Thank you. Nice to meet you too.
Any other students like to introduce themselves?
Okay, I'm gonna go. So this is Sonia. I'm currently in the AE program, and I'm in the LEAS track, but my interest is in psych. So it seems like this journey is gonna take me a little bit longer, but that's perfectly fine. So if there is an easier way rather than graduating and apply, I would like to know, because I'm currently working in the mental health field. So I would like to advance my career to further to, I'm currently as a therapist. So I would like to advance my career further to be able to prescribe one day as well. But regardless, this is the idea of where I'm gonna go. So if it's gonna take me a little bit longer, so be it, it's okay.
Hang in there and keep applying for the Psych NP program. We take them, as it's competitive, but we often turn down people that we don't want to. So, try the next year. You certainly get credit for coming back and trying again.
So do you mean like I should apply like every year, or how that goes?
So I would say if you're in your leads program, finish that. I mean, you're going to get valuable information and skill set, from completing that program. But absolutely, as you're approaching the end of that, certainly apply for the next year. And yes, apply every year. Absolutely. Because we do look at that. Hey, look, she really wants to do this. And, that does get you points.
And in the meantime, if you decide, well, I've had to apply 3 times there, switch your application over to the PhD program, because we'd be happy we'd be happy to help you find some psychiatric questions that need to be answered that you could be pursuing your PhD. And then when they go to review your application the next year, they'll say, oh boy, here's a mover and shaker. She's already started down the PhD route. We're not here to argue
also
with
be
each
said
other,
for the DNP route.
or the
It really can. We have,
yeah, sure.
We currently have somebody in the program who applied while they were in the DNP program. So I hear at UT. So that is true. But honestly, yeah, just keep trying. Because we do look at that, so don't take a no as no final, for sure, especially if it's your desire to come here to do it, which of course you should, because it's the best program in the state of Texas. Yeah, you should certainly reapply, because we have to turn down qualified applicants every year. Like every year, it's a struggle with all of us. The 4 of us literally spend days doing this. It's not an easy process, and it's not a quick process. It's a struggle. And so, but all I can say is if you really want to do it, coming back does count.
I have a question that is a general one, asking for a lot of our AE, like a student in the leads. So if we decide to graduate with the leads, right, and then go to a different track, like the either psych or family or whatnot, does that means we have to reapply for our clinical the year after?
I think that's a Stephanie a Dr. Key or a Dr. Divin question. I'm not exactly sure how the application thing works for that after you finish with the leads.
So Tracy would be the expert to talk to, but if you graduate with your master's in leads, then you would apply as a postmaster's student, which is a much shorter program, easier to work and go to school at the same time. So a lot less coursework with the postmaster's.
Yes, I want to second what Dr. Key just mentioned. If you've graduated, regardless of if it's leads or someplace else, you've already graduated. So you do have to apply, but it's as a postmaster's certificate program.
And at that point, there's multiple tracks with the School of Nursing that we can kind of choose.
Yes.
Or you can apply directly to the DNP or the PhD program.
Okay.
If you're trying to get into the psych mental health one and you don't get to do that on your first try, and I agree with Dr. Cruse. Yes, you should apply. I'm on that committee it's called GAPSI, Graduate Admission and Progression Committee. If you apply again the next year, you're already more qualified. You're more qualified than you were the first time you applied for it. But you can also apply for a more advanced degree. You don't have to go get another master's degree. You can actually come in either to the DNP or the PhD program without that intermediary step. And so that's another way to change gears.
I'll just put a plug in for anybody that's considering nurse practitioner, any of the nurse practitioner tracks. So nationwide, the movement is to have DNP education be the entry to practice for nurse practitioners by 2025. So that's just something to keep in mind if you're considering a nurse practitioner program, which program you're considering.
Gotcha.
Thank you about it.
And Sonia, I think I mentioned it before, in the foundation year, if sometimes occasionally there are seats that open up in some of the specialty, advanced practice roles, programs. And so if there are seats that open, Tracy will send out info on potentially transferring, but you do have to go through essentially, it's not a full admission, but you have to rewrite your statement of purpose. You have to get references. and then they can review applications. And, at that point, maybe you could transfer, but that's all seat dependent.
Hmm.
So be
Rachel,
on the
didn't you
lookout.
do that with us? Weren't you at AE transfer?
Yeah, I was actually an AE transfer last year. So what I did is Tracy sent out, I believe in either late February or early March, how many seats each of the programs had. And I had to write a personal statement. I think I had to get either 1 or 2 letters of rec from current professors. And then I think you guys use like a fairly holistic process to kind of decide. So if seats open up, that's definitely an option. But I actually know of some of my classmates who didn't transfer last year, and they've kind of looked into what they're going to do after they graduate with leads. And if you do leads and then you later go back to get your like psych NP, if that's something you're interested in, there's a lot less classes you have to take, especially your first year. So you can possibly work, save up some more money. So if psych NP is something that you want to do, even if you can't transfer this year, you should 100% keep up with it.
Yeah, because like I'm here with some other classmates. It's just that there is attractive things about the leads, especially some of us have supervisory leadership experience in the past. So it does open, it's not, I don't see these degrees as mutually exclusive. I feel like in a way they can support each other. Like you have this track and you can benefit from the combination of the two. So yeah, thank you for the information.
Plus you came to this, so you got to see one of the people who'd be interviewing you. So, win-win.
Any other
I'll
students?
actually ask.
Oh, go ahead.
Yeah, I'll actually ask a question. So I'm Rachel. I'm the secretary for ANGS right now. I just finished my foundation year and I'm in the pediatric primary care nurse practitioner track. So one of the questions I had is I definitely can see myself being the student who when I graduate with my master's, going straight into either my DNP or my PhD. Hearing someone just talk about how in 2025 they want everyone to have their DNP. I really like working with complex care kiddos and trying to keep them out of the hospital. My background in my undergrad was actually neuroscience and genetics. So those are 2 areas of interest maybe if I went back would want to do further research on. I just have a hard time sometimes understanding the difference between DNP and PhD. And if they're asking for nurse practitioners to have their DNPs, would it be okay for them to have their PhDs instead? I kind of still confuse the two.
Very basically put, PhDs are a research focused degree. DNP is a clinically focused degree. You can do research, you can do clinicals with either one, but they tend to have a stronger emphasis. DNP clinical, PhD research. And that's the most basic way that I can put it.
But I would like to
Rachel-
add to that because so the beauty about being a nurse, and especially being a doctorally prepared nurse, is that as a PhD prepared nurse, you can still practice clinically. As a DNP prepared nurse, you can still do research. So it really just depends. If you look at the 2 programs and compare them, I think we have something on our website, don't we, that looks at the 2 different degrees? I think we did at one point.
I believe we do, Dr. Christiansen. I believe we do.
Okay, and so it depends. And as Dr. Carter mentioned, the coursework in each program is going to be different. But what you do when you get out of it is really up to you as the individual, where you want to go. There's people there are hospital positions that are research focused, and so they have a combination of DNPs and PhDs working together. It really is a collaborative relationship too, because the DNP takes their expert from the bedside and can help inform the PhD prepared person about gaps in knowledge, and then the PhD prepared person takes their expertise and research methodology and helps the DNP person know, how that can be translated to bedside nursing and clinically based nursing. So it really is a partnership. I think one of the students just mentioned that. And so it's very, very true.
You might also be interested a little bit in the evolution of why there's a DNP and why it's coming down the historical hill, if you wanted to call it that people are going to be required to have the DNP by 2025. When the DNP was developed, as I understand, on the East Coast, the idea was we could do away with master's degrees, because really people who are practicing experts at the bedside really should have an educational preparation that is comparable to an MD in medicine. And so you see the same thing has happened in pharmacy. We've done away with bachelor's degrees in pharmacy. We've done away with bachelor's degrees in physical therapy. All of those helping professions, if you will, now have their entry to practice areas in graduate work, but their doctoral work and not master's level work. And so the DNP kind of followed along that same path. The problem is that we have so many nurses in our country and so many schools in our country that even though the East Coast leads the way, and they will have all their MSN programs probably gone before 2025, takes the rest of the country a while to catch up with them. So you're gonna see a lot of overlap in between the two, but I would guess that within the next 10 years, the master's degree programs, even at UT, will probably, if not completely disappeared, be pretty much on the way out, and will be replaced with DNP programs. And in addition, the PhD, we hope, will continue to thrive, because we do need both kinds of terminal degrees. And we need educators who have one or both of those degrees, and we need researchers who have one or both of those degrees. And actually, Dr. Champion, who's the director of the DNP program, she and I have frequent conversations about how we can actually develop a DNP PhD combined program, and have decided that at this point we can do it, but it needs to be individualized depending on the person's background and what their plans for the future are. So who knows, we may end up, just like we have an AE PhD program right now, someday we may have a DNP PhD program. But right now it's very individualized.
If you ever decide to do the dual DNP PhD program, I'm your girl. I originally wanted to go to med school, so I'll probably be in school forever.
Come on in. We'll work out a program for you.
I'm right there.
You can work on both of them at the same time.
But I do want to make sure that even though we're, 2025, they want doctorate prepared nurses, we're going to be grandfathered in, right? Like we're going to get our master's degrees and become NPs, and we'll still be able to be NPs even if we don't have our doctorate, right?
It would potentially
Yes, you will.
And it will potentially be the same as it is for BSN, right? Like it took 20 years probably to get to the point where the hospitals were
more than that.
That
history.
I'm saying 20 years ago, I still went, 25 years ago when I started, I got my 2-year degree, but they were already saying, okay, well, BSN by such and such. But even after they made that rule, whichever year it ended up being, it's still in the hospitals is really the only place that gets enforced a lot of times. And so you still would be okay to practice, but eventually you may find that your workplaces say, I need this, depending on what you choose for a workplace. So you may, even if, yes, you will be able to graduate, you'll be able to practice with your MSN, you may find that in 5 or 10 years, your workplace, if you're working at a progressive place or a place that's related to like an academic setting, that they say to you, okay, now we need you to go ahead and get your DNP, just like hospital nurses were told, hey, now we need you to get your BSN.
Yeah, the social policy statement that the ANA published in 1965 declared that all entry-level positions for nurses should be the BSN. 1965. So it's been more than 50 years by now, and we're still trying to make it happen. So yeah, these things move slowly, but whatever it is you want, go for it. And if you have to ask somebody to help you develop what is unique for you. when I went to school, I'll tell you a little bit about my long ago background. I was a student 53 years ago in a baccalaureate program at the University of Hawaii. And I was the first person in my class to be married. I'd actually been married a couple years by the time I got into the class. Most students back then were not allowed to finish diploma schools programs if they were married. Well, then I wanted to get pregnant before we left Hawaii. And so I was afraid to ask for permission. So I figured, okay, I'm just going to show up my last semester and I'm going to be pregnant and we'll see what happens. But in order to finish when I wanted to finish, I had to be able to take 2 semesters at the same time, which meant I had to take the pediatric clinical and the OB clinical at the same time. Nobody had ever done that. But I went to the faculty and I said, look, I'm out here with my husband. I only have 1 more semester that I can be here. Can I combine those 2 things? And they said, well, you know. And I said, well, can we try it? And we'll see how the first month goes. If that's not good, I'll do something else. But I managed to do it. And not only that, but at the end of the next semester, 10 days after I graduated, I delivered twins. So anything is possible if you believe that this is what's right for you and you're willing to work hard to get it done. So just persevere in that.
So with everyone's wisdom here and all your education and all your experience, being an AE student, and I think there are many AE students here, you know, I just became a nurse. I just entered and became a nurse in June, and then I'm going to be a psych NP in 2023. Do you recommend just kind of going through if you want to continue your education, or do you recommend taking some time? Because at this point, you know, I'm getting all this education, but I really feel like I'm lacking in the direct clinical experience at this time, like actually being a nurse. My experience with that is here at this point, you know what I mean? So I just I was curious on what your advice was on that. If you recommend taking some time to practice and be out in the field a little bit more before continuing your education, or just going all the way through.
I'm going to just speak about this from personal experience and some very wise words of wisdom that I received. And that was not to do that. And the reason why I was told not to do that was going to school is expensive. And what you want to do, unless you absolutely 100% without a doubt, this is what you're doing, this is where you're going, stop. Make certain that the degree that you have it's doing what you want to do with it. Because if it's not, why are you continuing on unless it's right for you? Because things change. People go to nursing school and then they decide they don't want to be a nurse. I've met a few people that have done that. So if you don't know, or you're not 100% certain, just hold on a minute and make certain that you know what you want to do. That would probably be my best advice.
And my advice is everybody needs to take their own personal path.
Yes.
Some people may need to go out and work and figure out, what do I really want to do? And some people are like, I'm just going to do it and we'll see how it all turns out. So I really think it's a personal choice that you have to make. And whatever choice you make, if it ends up, you look back and go, I wish I wouldn't have done it that way, you learned a lesson and you move on. And that's just kind of part of life. So I think you'll get a different answer from every person, but I really do feel like it's individualized and you can do whatever you want to do.
I agree. But it's a good idea.
Agree with that, but I would also say that experience does count for something in let's say specifically in the DNP program. So, the education is focused on a higher level of thinking, more systems organization type thinking. And if you've never worked in a healthcare system, that might be hard for some people to grasp. And so again, it's very individual. It really depends on what your background was before you became a nurse. and what your work experience was like before you were a nurse, and what your work experience is like as you are a nurse going through the school. So you may have gained enough experience with your new nurse degree and your new NP degree that you're prepared to start having those conversations in a doctoral program. But it is, I'll just go back to what Dr. Key was saying. It's so individual that you have to take a breath and think what's right for you. And not just you as a person, but your family and your work experience, and why did you do the nursing program in the first place? What were your goals and what did you want to do? So there were jokes like when I was in the DNP program, and I forgot, maybe Dr. Carter remembers what it stood for, but it was something about the D stood for divorce, because doctorate education is hard. It is hard, and it's work and it's commitment. So you have to really balance if you're able to work full-time as a nurse and go to work full-time in your doctorate programs. It's like having 2 full-time jobs. So you really have to consider it from the individual standpoint, but also with your relationships and with your family and how much support you have. And let's be honest, Austin is expensive to live in. So what are your financial resources in your situation? So there's a lot of factors that go into when is it best to go back for a higher degree. And you just have to weigh all of those things.
Well, I don't know what Dr. Christiansen's DNP stood for, but in my cohort, it was that I'm darn near perfect and a doctor of nursing practice. I'm not, I'm only one of those, but that's okay. We'll just.
Any other questions?
I would just say that anybody who is currently a student at UT is just absolutely surrounded by a magnificent group of faculty members who have all kinds of clinical experience, educational experience, and research experience. And you should not be afraid to approach any of us with questions about asking for advice for your future trajectory, and to allow them, allow us to share our experiences and expertise with you, but also to dream with you a little bit. You're all going to turn out to have a completely different trajectory than what I had, or than what Dr. Key had, or what Dr. Carter had. You're going to have your own unique path, and it's going to be magnificent because you're going to be a UT nurse, yay. But there's a lot of collective experience and expertise right here just on this panel. So don't ever be afraid to contact us, and let us see what we can help you work out for your future plans.
Okay, well, it's about 1:30, so thank you all so much. This was such a great experience getting to hear from all of you. Thank you again for your service and being willing to help students. It means a lot. And yeah, I guess we'll wrap up here. So thank you again for your time, everyone. And for all the students who joined today, I hope this was helpful. Thanks for coming to our ANGS event.
Thanks for inviting me.
Of course. All right. Take care, everyone.
Thank you.